Murses. I know you're thinking, doesn't he mean nurses? But no. Murses is actually more of a derogatory term that's used to describe male nurses in the medical field. And I know for a lot of men, they look at nurses and think it's more of a girly field. But that's why I'm here to talk about why men should actually become nurses. Men are like finding a double, male nurses are like finding a double rainbow. It's very rare to see them in the nursing field. And some people consider themselves lucky when they see one, other people don't. And that's just because they don't see men as compassionate compared to female nurses. For me personally, I work as a certified medical assistant in the nursing field for the last 3 years, and I know what it's like to actually be a male in the nursing field. It's not always the easiest, it's not always the nicest, but you always have to get your job done because what matters most is the patient care. In fact, there is currently only 9% male nurses in the medical field compared to female nurses. So, so many ma'ams and misses. I get called this so many times every single day. Despite looking at the patient directly, despite calling them, telling my name 100,000 times, they still look me directly in the face, look at my nice facial hair, and they're like, "So, how are you doing today, ma'am?" And I'm just like, "I'm doing good. Yes, yes, I'm doing good." And I know they don't mean it. I mean, they're just so used to seeing female nurses all the time, and they will tell me, "Oh, I just got done with my patient for my last appointment, and all my nurses were females." And I'm just like, "It's fine. I'm good with it. You can call me whatever you want to. Just get tell me your name and date of birth." I will admit that this can be discouraging at times when you spend a whole entire visit with them, mistaking you as either the doctor or calling you ma'am or Mrs. But at the end of the day, what matters most is the patients in their care, which is why whether you're a female or a male, it doesn't matter. So take a second to actually put it into perspective. And this is something that has actually happened recently. Called the patient and I introduced myself as Antonio Gabriels. They look at me, said, "Hi, how are you doing today, ma'am?" I said, "I'm doing fine." I smile and wave and keep on going. I take them to the room, and the entire time I'm triaging them, the entire time I'm drawing their blood, they call me ma'am or Mrs. It's a little discouraging. It's a little like, okay, how many times do I have to say my name? Do I look like a female? Like, I know the world is changing, but I still got a nice little facial hair. I still look like a male. They keep on calling you ma'am or Mrs. And even after the 30, 40 minutes, they say bye, ma'am. And then you're just like, hey, it is what it is. It's not it's not awesome, but you do what you have to do. So in order to kind of show you why male nurses have become more and more important, I'm going to show you why male nurses are important, why men also avoid becoming nurses, and why men should become nurses. So how important are male nurses in the medical field? Well, male nurses are desired in many fields, mainly critical care, emergency department, usually the ones that require a lot of labor, a long hours, and just because men consider to be a little bit more physically stronger. I know you're thinking, I'm not getting into the medical field because I want to be desired because of my physical strength or because I'm a male. I'm getting in there for patient care. But it is the truth that men are desired more because they tend to be able to work longer hours or they tend to be a little bit more physically fit. In fact, even the first ever nurse in the medical field was actually a male. Before it became more of a female dominant field, the first male was a man. It wasn't until after about World War II that females started becoming more into nursing, and that's just because men was more drafted, and then the shift from men becoming nurses shifted to females, and then men were more required to become doctors because it was seen that being a male nurse was actually pretty feminine, which is why we kind of have the stereotypes you see today about how feminine male nurses are and how they're not as good or how they're nice. So men avoid a nursing field for many reasons. One of the reasons is because they get mistaken a lot for being called a doctor. In fact, one of my coworkers, who's also a male nurse, once spent about an hour trying to convince the actual patient that he was the nurse and not the doctor, because the patient wouldn't even let them stick the IV in them, and that can decrease patient care. That can be demoralizing because you have to sit there and explain yourself over and over again that you're actually the nurse. Even if you show them your badge or anything, they still feel like maybe you're the doctor, or they're like, I don't want a male nurse because I don't think he's going to be as good, despite a nurse being a nurse. That's not how patients see it. And then males, many men think nursing is a feminine field. Well, I can tell you, having to stick an IV in a patient who's screaming and yelling is not very feminine. Having to deal with a lot of patient care, that's not the most feminine. I work in 16-hour shifts. There's nothing feminine about nursing field. Being a nurse is about being a nurse. It doesn't matter if you're male or female. What matters is how good of a patient care you have. Being a nurse is worth it. It's worth it all, not just because of all the benefits you reap, not because of the steady paycheck you get. There's so many things with nursing that you can't go wrong with. Whether you're wanting to work in triage and just call patients all day, or whether you want to work on the floor, working as a nurse gives you that nice steady income as well as health benefits that comes with it. And then once I said, there's nothing feminine about this job. There's nothing easy about this job. Both the men and female, we both do a phenomenal job. A nurse is a nurse, no matter what genitals they may have. As well as, being paid, very rewarding. There's nothing better than going home and knowing that you did a very good job, knowing that you changed a patient's life, that patient who came in here crying at the last minute when you're about to get off, came in here needing their insulin, and you're knowing that you have somewhere to go, but you take the time to help them out. That's a very rewarding feeling, and that's why you should disregard any stereotype you see to become a nurse. And as you can see, these are some of the stats when it comes to nurses. 91%, 92% of nurses are women. The average salary is 51,000, and that's just with like 2 or 3 years. You can make surgical nurses make $200,000. 45% of nurses are over 50, and there's so many different things you can do when it comes to nursing. Nurses are important, not just because of their physical features or what most people think, just because a lot of female nurses actually like having a change. Over about 91% of female nurses said that they actually enjoyed having a male on the floor to help them out, not with just difficult situations, but to talk to you about other things, and it's nice to have that change of pace. Yes, as a male nurse, if you do become, you will face hardships. There are stereotypes among us, not being as compassionate or not being as good, but that's just something that we have to deal with. That's something we cannot change. What we can change is the care we have for our patients and how good we are, and that's what makes the difference, and that's what makes most patients want to come back and see us. And trust me, it is worth it to work with so many amazing women. It's no better job out there. So I would like to kind of finish with a little food for thought. And others may think this is a feminine job. You may be called so many names. There's even a patient who said that my voice wasn't deep enough. And I was like, okay, let's continue, but that's fine. You're going to have to face those. Your gender does not define your ability to take care of patients. It does not define how good you are. Trust me, I'm better than most nurses in my field. And once of all, do it for the ladies. Hey, we want to work with a whole bunch of ladies instead of just one man that you get to goof around with, have them feed you stuff, and all the good stuff